In the United States, the rate of maternal mortality has soared to nearly 3 times that of other high-income countries. And among new mothers, mental health disorders are the leading cause of death. Healthcare providers have made progress in addressing the most common maternal mental health disorders, anxiety and postpartum depression. But barriers to care remain and disproportionately affect women of color. Ali Rogan reports as part of our Race Matters coverage.
Yeah, great job, Aiden. Yay!
Alassiana Jones gave birth to her son Aiden last summer.
Aiden is, I might be a little biased, but the best baby. His favorite color is red. He's super goofy and he loves to dance.
The birth was challenging, and soon after he was born, once the initial flood of emotions passed, she started feeling something else, something she'd never felt before.
I'm typically an outgoing, happy, bubbly person. However, I was not postpartum. I was self-isolating. I was sad. I wasn't sleeping at all. Things on social media just made everything worse. It was not pretty. It was not me. And something was wrong.
Jones was experiencing postpartum depression, which can be a severe, long-lasting mood disorder that affects roughly 14% of new moms. Yet the majority of women experiencing maternal mental health conditions go without treatment or a diagnosis.
I know everybody says, you're not the only one, you're not the only one. But in that moment, it feels like it. It feels like you're at the bottom of a hole and there is no way out.
While there is no single cause of postpartum depression, genetics, stress, and physiological changes like the hormonal shifts new mothers experience all play a role.
20 years ago, we wouldn't be having this conversation, for the most part.
What we want to do with the volunteers when they come in.
Dr. Catherine Monk is the chief of the Division of Women's Mental Health and Obstetrics and Gynecology at Columbia University Irving Medical Center.
We've really made a lot of progress in the last 20 years, and it's very exciting. There are evidence-based treatment. There are more and more people who are specializing in reproductive psychiatry, reproductive psychology. We're understanding more the roles of prevention that can come with the social support from people's communities and networks.
But Dr. Monk says there are still many hurdles to getting care. Black mothers are referred to mental health professionals less often, even though they are impacted at higher rates.
As a woman of color, it's even more difficult and even more scary.
Her fear of becoming a statistic led Jones, who lives in the suburbs of Detroit, to search out Birth Detroit, a Black-led midwife practice to deliver her baby and also to care for her after giving birth.
If you imagine your medical experience, you've been pregnant practically a year, and then you're told after maybe 24 to 48-hour stay, we'll see you later. Enjoy your new baby.
Ilan Jaffrard is one of the co-founders of Birth Detroit, which is designed to address the gaps in maternal care for Black mothers from pregnancy to several months into postpartum, when the focus is traditionally on the baby, not the mother.
Birth Detroit, we are in the home within 24 hours after birth. Then we're seeing you again at like day 3 or 4. Then we're seeing you again at day 7. And then we see you again at 2 weeks. We have healthcare professionals in the home assessing the family right in their own environment. And we're able to catch those things that can be more serious before they become more serious.
Jones says she was lucky her midwife recognized her symptoms and referred her to care.
You hear about these things, postpartum depression, postpartum anxiety, but you don't have a blueprint of here are the items to look for.
Jones received counseling and medication, but her midwife also referred her to a new center in nearby Ferndale, Michigan, offering something different.
We really wanted a space that moms could come and settle and spend hours.
Melissa Scodolero is the co-founder of Fourth Try Sanctuary, one of a handful of postpartum centers that have recently opened across the country, catering to new mothers seeking support and community.
The space was designed to be approachable and to help moms feel welcome and to be able to watch each other as well, because there's so much in learning and watching each other, and there's so much forgiveness that you can give yourself when you watch another mom do things.
The first day I came, I stayed the whole day, did not want to leave, and I kept coming back. It feels like a safe place for you to be vulnerable.
Part daycare, part cafe, and with a spa-like atmosphere, Fourth Try Sanctuary allows mothers to socialize with other moms, join information sessions, bathe their babies, or hand them off to experienced on-staff doulas while they shower, nap, or get their hair done.
The first week when I came here, all I did was sleep, which was really great.
After the birth of her first son, Morgan Vanderkay was diagnosed with postpartum anxiety, a common condition marked by excessive worrying and feelings of panic after childbirth.
I was crying a lot. I mean, there was no sleep as well, which doesn't help. And I felt very anxious, which I had never really felt before. And I just felt like I was going to fall down the stairs and like land on my baby and no one would be home. And, we would both be, dead. It was just like seemed so severe.
She gave birth to her second son in September, and she credits Fourth Try for an easier postpartum period this time around.
I just felt calmness. People check on you. How are you doing? How was your night? It's just been so nice to just sit in a relaxing hot shower and let the stress kind of melt off of you. I couldn't ask for a better postpartum period this time.
Fourth Try is a concept that came to Scott Alero, a mother of two, in her career as a salon owner, where she saw many new mothers looking for reassurance.
Someone would find me at a wedding and be like, is it okay that I give my baby formula today? And I'm thinking there must be a gap in the system if you're finding your hairstylist at a wedding and asking how you should feed your baby.
It's going to change because your baby's going to change. And as they get more solids, they usually take less breast milk.
Answering those new mom questions is what Fourth Try aims to accomplish with their daily fireside chats, informal conversations with experts.
And every mother was very worried about these babies, but I was more worried about you guys.
But all these amenities come at a cost, ranging from $35 for 90 minutes to $900 for a monthly pass. While clients can pay with a health savings account, Fourth Try does not currently accept insurance, but they are working to get their services covered because Scott Alero says she knows her center is helping new moms.
We have moms that walk in here a shell of themselves. They're not smiling, they're crying. And by day 5, they're like, this is a good day. The space was designed to empower moms and to give them a space to practice being a mom.
But that space can be hard to find.
The biggest impediment to recovery from a mental health issue is access to care. We really do have tools. We have evidence-based psychotherapies, we have pharmacology. The combination of the two is what's really the gold standard when medication is needed.
But medications can be pricey, like the one approved just last year by the FDA, the first pill for severe postpartum depression. A 2-week course costs nearly $16,000, and insurance coverage is inconsistent. Dr. Monk says progress has been made when it comes to treatment, but insurance companies simply haven't caught up.
We've developed a lot of workarounds, and we've not tackled the elephant in the room, which is reimbursement rates for mental health care for people who want to use their insurance to cover it. It is absolutely the elephant in the room.
Back at Fourth Try, Scott Alero has tried to make her services accessible to more women by offering scholarships in the form of a monthly pass to moms who are unable to afford them. Jones was one of the recipients, and she plans to keep visiting Fourth Try even after it expires. She says it's a much-needed continuation of care for her son and her.
Pregnancy doesn't just stop after you give birth, which is what it seems like our nation has ingrained in their brain. I don't think that it's a shock that postpartum depression is so high, unfortunately. But I do think it's a shock for the lack of care following postpartum depression. I do think that it's scary how limited moms have support there.
Support that places like Fourth Try are providing because it takes a village to raise a child and a mom. For the PBS NewsHour, I'm Allie Rogan in Ferndale, Michigan.